For almost 30 years, Dr. Ed Phillips has been helping his patients attain that perfect smile. We're here in downtown Toronto at the Studio for Aesthetic Dentistry to find out what makes the man behind thousands of smiles so passionate about what he does.
I had the great opportunity to begin my practice at the Hospital for Sick Children, and I worked in the craniofacial department. For a young kid out of dental school who only knew about little fillings, all of a sudden worked with plastic surgeons, recreating cleft palates, faces that were born with abnormalities, motor vehicle accidents, children with cancer faces. I was exposed to things that dental school never talked about. And being the dentist on staff, these plastic surgeons would ask me, well, what do you think? How should the teeth look for this person? I went to the research, there were no such answers. It just didn't exist. We really just looked at teeth from the form of function and health, but we never in dental school really were taught very much. Actually, ironically, the only time we talked about aesthetics was for dentures, but not people with teeth. So very early on in my career, I started to wonder about why do teeth make people the way they are, the way they look? And I researched it, I wrote articles on it, actually ended up writing a book on it as well. And so my career has always been involved with whatever aesthetics and cosmetics really means, but to me it really means trying to find the architectural natural beauty in how that person looks and how that teeth should fit into that picture. Well, I started dentistry in 1974. That's a long time ago. Aesthetically, we really put the studio together in 1997. I spent the first perhaps nearly 15-20 years of my practice really just working out a lot of concepts, working in general practice and doing the things that dentists do really well. I'm very proud of our profession. But in 1997 I had the opportunity to treat myself. What does success give you? It gave me the opportunity to create an environment where I could really work at a studio concept level where I'm not forced by the clock or by too much load of patients lined up, where I could really work on cases and take the dedication and time to really make each thing that I do an artwork, a masterpiece that's the right solution for that person. At the studio, I really have an ability, because it's such a small, exclusive environment. I really get to know the people I'm working with. It's part of the process to really get the result that they want. The people that are coming to see me want that kind of result. Not everybody needs a studio. I think they can get this work done beautifully by all kinds of great dentists in Ontario. But for people who want that type of interaction, I enjoy truly the human interaction that I'm having with my patients. They're not just forced to sit in a chair, open their mouth, and away we go. We get to find out about what they want. They come back to talk about it. Was it successful? Was it good? I come to work excited to meet the people and actually have a chance to interact with my patients, and I leave the day excited as well. I think I'm one of the few dentists that gets a lot of gifts, and that's always appreciative. But it could be a little basket of flowers or whatever, chocolates or whatever, but it's a sign that the patients do enjoy the interaction, and so I enjoy it too.